Hi, good evening. Having a very clear explanation of Green and Kreuter's Precede-Proceed framework, we're going to apply them in a few practical examples and with further questions at the end of each program. In the Philippines, the Precede-Proceed model has been applied to address hypertension in rural communities. During the Precede phase, social assessment communities reported limited healthcare access as a quality of life issue. In epidemiological assessment, it reveals high hypertension rates linked to poor diet and stress. Behavioral and environmental assessment identified low screening uptake and lack of health facilities as key factors. Educational and ecological assessment found low awareness as predisposing, limited clinics as enabling, and minimal family support as reinforcing. Administrative and policy assessment secured local government funding for mobile clinics. In the Proceed phase, Phase 6 implemented community-based blood pressure screenings led by trained health workers. Process evaluation, Phase 7, monitored participation, finding high turnout due to community trust. Impact evaluation showed increased screening and medication adherence, while outcome evaluation is tracking reduced hypertension complications. This program demonstrates how Precede-Proceed tailors interventions to local needs. But questions remain: how sustainable is funding for mobile clinics? And can it scale to urban areas? Next slide. Next sample, we apply the framework to adolescent smoking. Adolescent smoking prevention programs in schools use Precede-Proceed to curb tobacco use. In the Precede phase, social assessment, teens expressed peer pressure as a social concern. Epidemiological assessment, Phase 2, identified high smoking rates among adolescents linked to early initiation. Behavioral and environmental assessment, Phase 3, pinpointed peer influence and easy access to cigarettes as drivers. Educational and ecological assessment, Phase 4, found low-risk assessment or low-risk awareness as a predisposing, the lack of refusal skills as enabling, and social acceptance of smoking as reinforcing. Administrative and policy assessment, Phase 5, leverage school policies to support anti-smoking programs. In the Proceed phase, Phase 6 implemented peer-led workshops teaching refusal skills and health risks. Process evaluation, Phase 7, confirmed high student engagement due to peer facilitators. Impact evaluation, Phase 8, showed reduced smoking intentions, while outcome evaluation, Phase 9, tracks long-term smoking rates. This program highlights the model's ability to address youth-specific behaviors, but questions arise: how effective are peer-led programs long-term? Can they counter online vaping trends? Next and last slide. Our last example in the application of this framework to a program is regarding diabetes prevention in indigenous communities. The diabetes prevention leverages Precede-Proceed to address unique health challenges. In the Precede phase, social assessment revealed concerns about cultural erosion affecting health practices. Epidemiological assessment, Phase 2, confirmed high diabetes rates linked to genetic and lifestyle factors. Behavioral and environmental assessment, Phase 3, identified poor diets and sedentary behaviors worsened by limited access to healthy foods. Educational and ecological assessment, Phase 4, noted low nutritional knowledge, which is a predisposing, the lack of local resources, which is enabling, and a weak community support as reinforcing. Administrative and policy assessment, Phase 5, secured partnerships with tribal leaders for culturally sensitive programs. In the Proceed phase, Phase 6 launched nutrition workshops incorporating traditional foods and exercise. Process evaluation ensured cultural relevance through community feedback. Impact evaluation, phase 8, showed improved dietary habits, while outcome evaluation, phase 9, monitors diabetes incidence. This program underscores the model's adaptability to cultural context, but questions remain. How can programs sustain engagement in a remote area? Are traditional foods scalable for diabetes prevention? Apologies for the recording. I'm currently stranded en route to my flight home, so I will now hand you over to President Marvin for the summary and conclusion.